Now, the opioid crisis is a very serious problem. That's that's impacting a lot of Midwestern white people. Now, these are people who are formerly middle class, working in manufacturing or related industries, who saw a lot of that disappear within the last decade or more. Or they're also people that have worked all their lives and developed, whether it be back problems or any sort of chronic pain issues, and were prescribed powerful narcotic pain relievers like OxyContin. Now, the thing about OxyContin and those and similar drugs is they happen to be very addictive. They get hooked on it, and then that leads to heroin abuse. Now, these are the people that President Trump had promised to help. So yesterday, in a story that was buried, and understandably so, by the spat between Trump and Kim Jong-un and the possibility of nuclear war, during all that, Trump made a special announcement on what he plans to do in order to fight the opioid epidemic. Now, if you're thinking that he's going to do something positive here, that he's going to expand treatment, you would unfortunately be wrong. And that's a bummer because, look, I was hoping that Trump might actually do the right thing and start decriminalizing drugs and putting more money towards treatment centers, but he's not doing any of that. Politico explains. They reported on Tuesday that Trump vowed that his administration would beat the opioid epidemic by, number one, beefing up law enforcement and strengthening security on the southern border to prevent illegal drugs from entering the country. Trump joined in Bedminster, New Jersey by Health and Human Services Secretary Tom Price, as well as other administration officials, emphasized a tough law and order approach rather than new treatment or social programs as the White House's primary strategy for halting an epidemic that kills 142 Americans every day, according to federal statistics. He apparently said, "Strong law enforcement is absolutely vital to having a drug-free society. I'm confident that by working with our healthcare and law enforcement experts, we will fight this deadly epidemic, and the United States will win." It's funny how he talked about experts, but we'll get to that in a minute. So basically, what he's proposing is doing the same thing that we've been doing before for decades with no success. Oh, but don't worry, guys. It'll work if we just do it just a little bit longer. Look, I don't know who in the audience or if there's anybody in the audience that thought that Trump might act differently on drugs. I know there's some libertarians out there that are like, no, man. No, he's gonna legalize weed, man. It'll be great. What now? That didn't happen. That's fairly obvious. Now, Washington, D.C. politicians, we know that they're locked into this drug war mentality, despite its complete failure to actually stop the problem of drugs. There are different factors to that, of course. They think that giving cops more money and that giving more money to private prisons, that's going to help out. And, of course, all that private prison corporation money flowing into them, into their re-election campaigns, well, that doesn't hurt either. So, now let's be honest. As I said, they give a lot of money to Trump. Corrections Corporation America and Geo Group gave a lot of money to Donald Trump's election campaign and also to his inauguration party. And this is the kind of stuff that they got in return. See, the strategy is, well, to put it in a certain phrase, it's yummy in their tummy. They love this. They're like, yes, crack down on drug users even more so that we can get those people to fill our prison beds. And then we get the profit. That's what happens. Now add this to Jeff Sessions and his now Injustice Department strategy. It gets even worse. Anybody who thought that Trump was going to disempower the establishment and change drug policy, well, you guys were wrong. What we get is another standard pro-drug war politician. Now, he's rolled back even some of the modest reforms from Eric Holder's Justice Department. He's brought back civil asset forfeiture and made a deal with the private prison companies, of course, in order to fill their beds, which, again, in turn equals more profit and more campaign contributions to these pro-drug warrior politicians. That's Trump's plan. He never cared about treatment, never cared about decriminalization, and it's all over. Now, Politico writes that the Trump administration has consistently taken a law and order approach, despite concerns from experts who say treatment should be the top priority. I mentioned experts earlier. Well, this is what the experts are saying. And this is his own commission, by the way. The administration, look, okay, well, I'll get to that in a minute, actually. But first, I want to talk about what his administration is actually doing. The administration is had also backed the GOP's Obamacare repeal and replace proposal that the CBO estimated would slash Medicaid, the largest payer of behavioral health services, by $800 billion. Advocates have stressed that such a proposal would almost certainly result in less access to treatment for people with addiction. Again, more proof he doesn't care. Medicaid actually does help people who are addicted be able to get off their addiction and to get back to living actual life. But again, since it helps real people, they're not interested. They're only interested in helping people who give Trump money, or people who give these Republican politicians money to be tough on crime. But see, the people who are addicted to this, they don't need prison, they need treatment. And Medicaid actually helped them be able to get treatment. They were able to get insurance through the Affordable Care Act's Medicaid expansion. About 1.2 million Americans who have need of addiction services were able to get it through the ACA thanks to Medicaid. It also paid for 35 to 50% of all medication-assisted treatment administered to help fight opioid addiction. And this is according to the National Council for Behavioral Health. But hey, let's get rid of that so we can give tax breaks for the rich. Let's not help people with addiction, and let's instead lock them up and build a fucking wall. Well, how's building a wall going to help stop the drugs, to stop people from getting hooked on illegal drugs? A wall is, what are you going to do? Build a wall in the pharmacy? Like, no, you can't get those legal prescription narcotics, the Oxycontin, because we built a wall. No, that's ridiculous. I understand they want to keep the illegal heroin from coming in, but heroin is a symptom. Okay, they're really getting addicted from these doctors writing these prescriptions for these powerful narcotics that more often than not, to be honest, a joint would probably fix. They've done studies where preliminary studies where people will smoke, marijuana for pain, and it actually is more effective than some of these powerful narcotics. Oh, but the pharmaceutical companies don't make money from that, or they can't make money from that. So let's forget about that. No. Look, building a wall, it's not going to do anything. It's not going to fucking help. You want to hurt the cartels? You want to stop drugs from coming across the border? Legalize them. I know that seems counterintuitive, but think about it this way. Cartels thrive on the black market. Now, we've already seen what happens when you legalize drugs. Take marijuana, for example. Colorado and Washington, when they legalized marijuana, that actually cost the cartels millions of dollars. They ended up switching to harder drugs because they weren't making as much money on smuggling in marijuana. It was no longer worth it, okay? And in case you think that, no, but if you legalize drugs, it's going to make more people be on drugs, right? Actually, no. There's another study that looked at Portugal. Portugal, years ago, decriminalized all drugs and found lower rates of drug addiction among their population than when they had it criminal. So now what they did is that after these addiction rates fell and they decriminalized, well, they took all the money that they were spending on drug enforcement and incarceration, and what they did is they put it into treatment centers. So if somebody got addicted, they could go into a treatment center and they could get treatment for it. And the result is that they have a lower addiction rate and are actually saving money, and they're also saving lives. But that's not the president's goals. It's not the goal of Jeff Sessions, who's going against his own commission. Again, I talked about the experts, right? And this comes from the White House's own commission on combating drug addiction and the opioid crisis. Now, last week, they released a report that recommended that they make an emergency declaration. Now, what would that do? That would actually allow the federal government to move more quickly to free up federal funds to expand access to substance abuse treatments, specifically medication-assisted treatment, the very thing that they're actually looking to cut. They're doing the opposite of what their own commission says that they should do. Now, that is not surprising. If anybody remembers the Schaefer Commission, for Richard Nixon, they said, oh, yeah, by the way, marijuana, not what you make it out to be. Nixon says, no, fuck that. I'm going to use it as a racist tool to get rid of my political enemies, the liberals, the Mexicans, and the blacks. So, yeah, war on drugs. Let's do it. So, look, Republican presidents kind of have a history of going against their own commissions. So it's not surprising to see Trump and Sessions going against their own. They're looking to cut treatment programs in favor of doubling down on a failed drug war and to try to build Trump's stupid fucking wall, proving that once again, this administration is not interested in real solutions to a problem that is certainly real and is having a real death toll in the places that voted for him. Hey everybody, thanks for watching this video. If you want to see more like this, please hit the subscribe button below. And if you want to support truly independent progressive media, please consider becoming a patron at patreon.com/TYTNation.